Over the past few years, conversations about mental health have dominated our cultural consciousness. What was once a highly stigmatized and taboo subject is now being talked about online in YouTube videos and Twitter threads, and IRL in classrooms, living rooms, and offices all over the world. However, for Black, African, and Caribbean people across the diaspora, mental health remains a difficult topic to tackle. Just like our physical health, our mental health is influenced by a number of non-medical factors, otherwise known as the social determinants of health. The World Health Organization describes the social determinants of health as the forces and systems that shape the conditions in which people are born, grow, work, live, and age. These social, political, and economic factors are all impacted by anti-Black racism and systemic discrimination, which can lead to detrimental mental health outcomes for Black people. In 2020, the Canadian federal government conducted a study titled Social Determinants and Inequities in Health for Black Canadians, a snapshot. Many of the findings were troubling. Let's take education, for example. Data indicated that Black high school students were more likely to be streamed into special education and applied programs, while being the least likely to enroll in post-secondary education when compared to their non-Black counterparts. The study also found that discrimination against Black youth was linked to negative stereotypes and lower expectations from academic staff, who themselves were largely non-Black. In 2016, only 1.8% of Canadian elementary and high school teachers were Black. Unfortunately, the study revealed similarly poor outcomes across numerous different areas, including employment, housing, and food security. Of course, COVID-19 hasn't helped much either. According to a 2020 Stats Canada survey measuring the mental health of visible minority groups throughout the pandemic, Black people reported poorer self-rated mental health and greater financial insecurity when compared with white participants. All of this raises one very important question. How do we start prioritizing the mental health needs of Black Canadians? To explore this issue in more depth, Empowering Black Girls YEG invited 3 Black youth and 1 Black mental health professional to weigh in on their experiences navigating mental health as Black Canadians. Here is what they had to say.
My name is Naomi Andala. I'm from Edmonton, Alberta. I'm 17 years old. My pronouns are she, her, and I identify as an Afro-Canadian, more specifically an Ethiopian Canadian.
Hi everybody, my name is Emma and I am 23 years old. I was born in Ghana, West Africa, and raised here in Canada. My pronouns are she, her, and I identify very strongly as being African Canadian.
Hi guys, my name is Ashley Ekpo. I am 24 years old. My pronouns would be she, her. I identify as African Canadian.
Hello, my name is Simba Uzandi, and I'm a mental health therapist. I'm from Zimbabwe, born and raised there, left just after high school, and I've had the privilege to travel different places around the world. I did spend most of my adult life in England, where I did my undergrad and then moved here to Canada, where I've been staying for a while. And while here, I went and I pursued my master's in clinical social work. So I'm a social worker by background, specializing in mental health. My pronouns are he, him, and I identify as Black African.
I've most definitely experienced racism and microaggressions. Microaggressions are part of day-to-day life. I go to a school that is majority white, and with that comes a lot of ignorance and insecurity for myself that I've had to learn to grow out of and learn to truly love myself for who I am. You also have to learn to pick and choose your battles as a person of color, and that can be really taxing emotionally.
Have I ever experienced racism or racist microaggressions? Yes, I have. they have impacted in my mental health in ways I didn't realize. Like certain ways I act, certain things I assume for people or a group of people, that's how racism has affected my mental health. It's like it changes the way I view myself, it changes the way I'm expected to be or expected to look. And that's not good. I just recently became aware of that, and I've improved on that majorly. I would say around 6, 7. With family, I would say more towards 6, 5, because I come from this African family, and you know the African mentality. African culture doesn't really stress enough on mental health. They just think that, it can be fixed with praying and doing well in school. It's like a black or white answer when it comes to African families. But I think lately, the world has been changing, African mentality is changing a bit, and with my family, I can bring it up 100%. With peers, 6 or 7, because it depends on the person. It depends on if I feel like this person can handle this conversation, or is this person gonna shut it down. If I feel like this person will shut down this conversation, it will be towards the 6 or less. If I feel like this person can handle the conversation and is open towards it, I would definitely go 7 and up.
I'd say that I'd fall around a 6 on that scale, because I'd find that with my friends, I'm incredibly comfortable talking about mental health and stigmas around it. However, with my family, growing up in a culture that stigmatizes mental health, it's definitely hard to have those conversations. I'm definitely willing to have conversations with my family about mental health and overcoming the stigma. However, I'm entirely uncomfortable talking about my own mental health with them. So,
personally, I'm an open book, and I can easily tell stories about my mental health experience with no fear, little fear. That's because I don't really attach what others feel about my experience to my self-worth. If I tell you a story about something I've gone through, or my opinion or reform that I think needs to take place, and you don't agree, you don't understand, I won't take that personally, because I know what I've gone through. What I do have a bit of an issue with, and the kind of conversation I don't engage with, is when I am opening up about a story and you feel, and by you I mean the person I'm listening to, and the person I'm speaking to feels the need to discredit what I've gone through, or try to explain retrospectively what it is that I went through, thereby discounting everything that I went through. It's not that I feel stigma or shame about that, but I just don't want to engage with people who are trying to dispute my life story.
I think that there's a lot of stigma within the Black community about mental health, especially from immigrant African parents. I find that most African cultures or non-Western cultures very much stigmatize mental health, and it's a very taboo topic, and people are often shamed upon for discussing their own troubles mentally. So it's that stigma has, I guess, followed us here in the Western world, and has made it a lot more difficult for the Black community to really congregate and overcome mental health challenges, especially for females.
I don't think there's a reluctance to talk about mental health in the Black community, but I do think that the approach can be maladaptive at best and toxic at worst. That's from my experience. Mental health in general has to do with keeping yourself, the relationship with yourself healthy, and the relationship with others healthy. I think that's how I understand mental health. And it's about that functioning. So it's clear to me that Black people would agree that this is an important part of life. I think anyone would agree that this is an important part of life. But I think the approach can be not healthy, and not sustainable. There can be some sort of disconnect between what I feel and how to treat it. If I say I am depressed because my friend just passed away, I think the community that I'm part of, Black and African community, would rally around that and say, that makes total sense. That wouldn't be an inappropriate response to mental health, an inappropriate response to what I'm going through. If I were to say I'm depressed and I don't know why, maybe there's a chemical imbalance in my brain, I think that's where the issue starts, because the reason for my depression is less overt. I think when a lot of mental health is covert, I mean, it's literally in your mind. So when the reasons for things are something we can't directly see, I think that's when mental health becomes a bit of an issue for some people in the African, Black, Caribbean community.
Talking about social, political, economic, and other obstacles, that prevents Black people from seeking out mental health care. I think it's no question that Black people are more likely to experience prolonged and uncontrollable stress, and because socially, economically, we find ourselves in the margins of society, in terms of low income, poverty, criminal justice system, housing, and so that overactivated stress system makes us vulnerable to mental illness and emotional and social dysfunction. However, the origins of mainstream mental health were not really designed to cater for other ethnic populations. So it's not inviting, for other cultural groups. There's a lot of documented and researched racial biases within mainstream mental health services, and some of them are, Black people are more likely to be detained under the Mental Health Act than their white counterparts. Black people are more likely than their white counterparts to end up in the criminal justice system as opposed to the mental health system. So again, I think within our communities there's an overall distrust, within the Black community, with mainstream, mental health kind of like systems. Access to good health benefits could be another barrier, because things like therapy and counseling, traditionally, for middle class, privileged people that can afford it, it's quite an expensive service to access. And when you don't have a stable job with all these benefits, it's another obstacle and a barrier in accessing support services like counseling. From my experience, the idea of Black male as being this stoic individual who does not really show any vulnerability and no affect, is one issue that I've found to play a big role in the reluctance, to talk about mental health. And for myself, I remember, growing up, showing any emotion was viewed as a sign of weakness. In fact, the only emotion that felt comfortable to express as a strong, Black male is anger and aggression, and I think that's kind of a huge misconception of what being strong is. Advice that I wish I would have received, in my youth when it comes to managing mental health. I wish I was told that it was okay to feel, that there was no shame in expressing emotion, that, emotions and feelings are just a part of who we are, and it's okay to express it. And if I was told that, that would have helped me, gone a long way in helping me being in tune with my feelings and my emotions. And it's only when you're in tune with your feelings and your emotions that you can actually actively get support or seek support, with those aspects of your functioning.
On January 16th, select members of Empowering Black Girls YEG organized a virtual event titled Mental Health, the Melanin Experience. We invited Black youth to take part in a candid conversation about mental health in the Black, African, and Caribbean community. Over the course of 2 hours, Simba, psychotherapist Lul Begashaw, and mental health first aid instructor Sabrina Morrison examined the difference between mental health and mental illness.
It's basically when you have a diagnosable disorder, according to the manual that's used in that field. So, however, when you look at mental health, it's broad. It's how you function. It's how you are in the world.
Discuss the importance of representation in the mental health care system.
I think it's really, really important to have Black representation, especially in the right places in our structures to kind of like influence change, that will be an effective change, because after all, we are the ones who know best, about our needs and how our needs can be met best.
Walked attendees through scenario-based responses to everyday mental health issues.
When we look at the disturbance, is that anxiousness of that party or that sadness of a loss of a loved one, that feeling is consistent for about 2 weeks or more.
And so much more. As the group reflected on what was shared, the session wrapped up with mindful breathwork led by mental health activist Janika Wilson. Having these kinds of discussions is important for breaking down the stigma around mental health in Black communities, but gaps in the accessibility of mental health services still need to be bridged, especially as we continue to grapple with the effects of COVID-19. Thankfully, there are some great mental health resources that we can turn to here in Edmonton, including the Alberta Black Therapist Network, the Africa Center, the Edmonton Mennonite Center for Newcomers, and Action for Healthy Communities. There's still a lot of work to be done, but with the power of education, advocacy, policy, and community, the mental health needs of Black Canadians will never again be ignored.